Good afternoon and welcome to Transitional Leadership. Where are we going? How do we get there? And who's driving the bus? I'm Robert Thorn and I'll be leading this session today with Kyle Kramer, an associate of mine here at Pinnacle. And before we get into this, I want to talk a little bit about if there was a year of business as usual, 2020 and as we're finding 2021 is not it. The demands for consumer improvements and value-based care, technology advancements, and factors such as social determinants of health, implicit biases, and access to care have all risen to the surface. Add a pandemic into the mix, and we have a recipe for a bottlenecked system that is challenged like never before. In this session, we're going to have a dialogue about how organizations can stay focused on strategies to address these and other issues, where opportunities may lie, and how to ensure success in an industry that is one of the highest leadership turnover rates of all. I'd like to introduce my associate, Kyle Kramer. And Kyle, you want to take a minute and introduce yourself, talk a little bit about your background?
Thanks, Bob. Appreciate that introduction, and I'm happy to be joining you today. I am a senior director with Pinnacle, and I'm also serving as Chief Executive Officer for Day Kimball Healthcare in Putnam, Connecticut. I've spent the past 30 years as a part of executive leadership teams at organizations across the country and also doing advisory work to clients across the nation as well. I've spent majority of my career working in large academic medical centers or teaching settings, but the organization that I'm leading now is quite different. It's a small rural community hospital where size, scope, and scale is vastly different than your traditional academic medical center. And in a lot of ways, it puts the topic that we'll be addressing here today in a vastly different light and places a much greater degree of importance on some of the concepts of leadership that we'll be discussing. So thanks for inviting me to join, Bob.
Yes, my pleasure. I'm glad you're here. Hey, I wanted to echo on your background. I have a similar background. Maybe it's more focused on rural than urban, but we both have both. About 30 years in the industry and serving in interim CEO roles up through the middle of the pandemic, and always standing by, waiting for the need to go and do it again. Yeah, I think between the two of us, I'd like to just have a dialogue today about some of the challenges we have, whether they're in a permanent or even a short-term role, regarding planning and making commitments for the future where the opportunities might lie. And how do we do that when there's constant change around us, not just change in the industry, but change within the organizations, because CEOs in healthcare have the highest turnover rate, I believe, of all industries. It's over 20%. So that's very challenging to do in this environment with all the dynamics CEOs have to deal with anyway. And so I just wanted to hear some thoughts about some things that we're going through right now. And I'll say it, COVID-19. Let's just get it out there, put it out there. Seems to come up in every conversation in the hospital. Most anywhere for that matter. You can't go anywhere without having somebody say it in a sentence. It's not the world off its access, but in terms of access to and delivery of healthcare, what do you feel we've learned from this pandemic?
So I think the first and foremost thing that we can say about COVID-19 is that it's forced us to really retrench and think about everything that we do differently. But I also think that it has forced us to really think about the value of our resources. If we think about the frontline healthcare provider team, which obviously is comprised of our physicians and nursing staff, they clearly play such a tremendous role in our ability to respond to situations like this, or quite frankly, any situation. But I also think that the pandemic itself and all of the logistics that have gone into addressing the issues and the concerns of managing on a day in and day out basis have highlighted the importance of those resources that are perhaps a little less visible certainly laboratory services have been tremendously critical to our ability to respond to the pandemic in and of itself from a diagnostic standpoint. So laboratory professionals and all that both labs inside of hospitals and external laboratories are doing have been critical to our ability to diagnose patients with the COVID virus. In addition to that, if you think about supply chain and materials management logistics, the ability to rapidly access, acquire, engage, and distribute PPE has become something that is vastly more critical and has been something that has tested even the best of systems across the country. And I think the other piece of the whole learning process has been that if you think back over the course of the past couple of years, sitting in January of 2020, I don't think any of us from a leadership perspective would have ever expected that the most critical piece of equipment and technology that we might be working with over the course of the next 12 to 18 months was going to be something called a swab. A very simple Q-tip-esque piece of material has served as the basis by which we've made decisions as to whether a patient is positive and they might need to quarantine, whether they need to be admitted for further care, or whether they are potentially safe in terms of not having the virus. It's kind of an interesting perspective because in a lot of what we do, we think about our equipment, our technologies, and our tools as being those things that are big, exciting, sexy, like robots or big imaging systems or novel diagnostic technologies and whatnot. But instead, what's been one of the most prominent pieces of equipment for us has been something called a swab. So I think what that emphasizes to me, Bob, is that the big things are important, but where it really happens is at that little level. And the smallest of things can sometimes make the biggest of differences. And in the course of the past year, I think what we've also seen from a grounding standpoint is that everything we do matters, every member of the team matters, and every aspect of what we do matters to the people that we serve.
Yeah, and I just have to agree with you. I think this is such a learning curve. And I think there's a natural selection, just like in nature. Those that were well prepared adapted, and those that weren't didn't, or were slow to adapt. And they suffered some of the challenges more so than those that were better positioned. People that had a stronger handle on how to be nimble and adjust and just be able to respond. And as you were talking about the swab, I was thinking of the chain is only as strong as its weakest link. And if your weakest link is a 5-cent, piece of, stick with a cotton on it, that can bring the whole system down, you learn that real fast. And so you can't take anything for granted either. And
I think your comment about the ability to quickly adapt, if we contemplate what the Marines motto is, improvise, adapt, and overcome, it's really what we've had to do on a daily basis, sometimes even hourly basis. And I think that invites a bit of discussion about, okay, we're not going to be able to do elective procedures or elective diagnostics or office visits in the traditional way. So how do we continue to maintain that connection with our patients? What are, and I think there have been some novel things that have evolved out of this year that have caused some rapid adoption of some things that we as advisors and leaders might have always felt were important, but weren't necessarily embraced by the industry. And I think telehealth is a great example of that. And I don't know about you, but in the realms where I've been focused, the rampant and extremely rapid adoption of telehealth as a vehicle to engage with and manage patients has not only become something that has been a means by which we connect. I think it's an opportunity to stay with us on an ongoing basis.
Yeah, I would agree with you on the telehealth. It's interesting because telehealth's been around. I've been working in telehealth for more than 20 years, and the incentives were always misaligned between those that would use it, whether it's a consumer, patient, or a physician, or one of the providers in the offices. You know, their incentives weren't necessarily aligned. And finally, in some states, like the one I'm in Colorado, they created a parity law. So payment for a telehealth visit was the same as an in-person visit for every payer in the state, including Medicaid. The only exception to that was um, Medicare. And with the pandemic, um, the rules got changed, so Medicare could be used similarly to an office visit. And I'm hoping that's one of the things that stays as a result of this. But what's interesting was the alignments were primarily economic in the past, where reimbursement had to be comparable for physicians to be motivated to use it. Not motivated in the fact that they were being unreasonable. It's just that it was hard to be productive to go from one setting to another. And somebody's going to be paying a price for that. A lot of times that was the physician, just their productivity. The What was interesting when the pandemic came on, the incentive changed from economic to clinical. And you go from one day of not having anybody want to do telehealth. They'd roll their eyes when you'd say, come on, can we do telehealth? Why would I ever want to do that? To, I don't want those patients in my office. We don't know enough about this thing yet. Or the hospital's telling people they can't come to my clinic. I still want to see people. How do I do this? So it shifted to more of a matter of need for a clinical care than it did an economic incentive to provide clinical care. So I think it helped us identify the right place for it at the right time. And as we move forward, this kind of brings me to another question. What do you think about the post-pandemic mindset? What's that going to be like in both in hospital setting and outpatient and physician clinic setting? What do you envision a post-pandemic world to be like?
So that is a very, very interesting question. And I think we could take that in about 14 different directions, just to get started, and then segue that, probably about, 1,000 others as well. But I think there is a reality to the fact that, we know through this whole endeavor called COVID-19 that we as human beings crave human contact. So I don't think that, in spite of the rampant evolution and implementation of telehealth, that we're ever going to get away completely from in-office setting. But I do think that there is a piece of the concepts of what we've done to sustain ourselves from a patient relationship standpoint through the course of this period of time going into the future that parlays very nicely into the concept of population health management and value-based care. We know that adherence to clinical protocol and prescribed care regimen is vastly more likely to occur if we have more frequent contact. We know this from our chronic disease populations: heart failure, COPD, asthma, diabetes. The more we're in touch with patients, the more likely it is that we're going to head off acute exacerbation of specific types of episodes. Telehealth, I think, becomes a very viable and vital portal by which we maintain some of those contacts. So I don't see that as ever going away. I think the other thing that we will probably see from an acceleration standpoint is a more conscious and intentional effort around engaging populations in behavioral management such that they are less vulnerable. And obviously what this highlights for us as well is even more specifically the need for us to advance, accelerate, and elevate what we're doing in a behavioral health standpoint. Think about it. We've talked a lot about post-traumatic stress disorders, and certainly individuals in the military are very prone to this given some of the things that they've seen. But if we think about what's happened with the youth movement over the course of the past year, and we think about how social activity for many of our young people, from elementary school to middle school to high school and college, has been taken away from them. That's a traumatic event. I think the need for behavioral support is probably going to be even more significant and more prominent. So to me, I think there's a strategic aspect of how do we prepare for that as we go forward? How do we build some of those behavioral types of assessment tools more specifically into primary care evaluation? How do we create tools that are available through app-based platforms that allow us to engage in a dialogue around something that is sometimes a verboten discussion and is a challenge for many people? But I don't think any of us would say anything less than the fact that this past year has not been the best experience that we've had in our life. I think there's a lot of good things that have come from it. I think there's a lot of things that we don't even know yet that will come from it that are going to manifest themselves over time. And I think the post-pandemic world is definitely going to change. I think we would be much more keenly on point with regards to how we can rapidly mobilize resources. And I think, a great example of that is what's happened with regards to these mass vaccination clinics that we've seen across the country, the ability to very rapidly move in and manage many patients at the same time, either from a care perspective or a vaccination perspective. So I think what we've learned is that we can do a lot in a hurry. Never let a good crisis go to waste, right? So I think this has invited an opportunity for us to step back and think very quickly, how do we do what we do differently, and how do we address things on a mass basis? Probably none of us would have expected that we would be doing it on this scale nationwide, but nonetheless, that's where we are. And I think there's another piece of it that just gets into the fact that having the human connection is going to be critically important. I think the other piece that is of critical importance to recognize is that an event like what has occurred over the past year has the significant potential to drastically change what we see from a staffing standpoint. Many of our nurses are in the advanced stages of their career. Does this become a tipping point that says, I'm done? And do we have the backfill potential to be able to address what could become a very substantive nursing shortage? And I don't think we do, because we're seeing lower enrollments in nursing schools than before. So we are headed into what potentially could become a very significant nursing shortage.
Well, I think you touched on a couple of points I wanted to emphasize as well, which is the human aspect of this, the humanity. When we get into technology advancements, we tend to lose sight. And prior to the pandemic, we were losing sight on technology's has always outpaced the adoption process because people were wanting to continue with the human touch. And I think if the pandemic showed us anything, the human touch is not always possible in certain environments, like trying to get people into a clinic. So you have to rely on technology, but it's also a reminder that we cannot forget about the humanity. We saw the toll it took on patients that, I experienced this as well with an elderly relative that I could no longer go see. Just you're reminded of that, and and the caregivers, the providers that are providing us care every day, the humanity that we sometimes forget or we take for granted when we tell nurses you're going to have to work, you're going to have to double down and, try even harder to deal with this. You're on the front lines. We can all appreciate that. You and I can go back to our offices. They live with it 24 hours a day as long as they're standing in their roles in the hospital. So we had reminders of the need to recognize the humanity on a number of different fronts, both on the patient side and the provider side, that we need to make sure we learn from moving forward. So otherwise we will not have a workforce, and we will not have access channels for patients to use, because there's a good chance we could get hit with another pandemic. You know, it's been 100 years since we had a worldwide pandemic. Who knows if it's going to be another 100 years or it's going to be another 4 years or shorter, who knows? So we have to really learn from this moving forward, and recognize the human aspects of this. I wanted to kind of shift gears a little bit and talking about the post-pandemic world. We think is going to adopt what we think is the best practices in terms of technology. I call it the high-tech, high-touch balance of technology versus the humanity. What about day-to-day operations like strategic planning that I know some organizations have put on hold because it's, they said their excuse was, I don't know what I'm going to be doing in 3 months from now. And it's very tempting to say this. So how do I know what I'm going to be doing in 3 years, 5 years, or whatever? I don't know how long this pandemic is going to last, and I don't know what its lasting effects are going to be on us. What do you think about strategic planning at a time when we've gone through this? Do you feel that there's going to be a need to refocus on that, or some maybe never gave up their focus on it? How do you view that going forward because of so many uncertainties we've had in this last 18 months?
Yeah, it's a great question, Bob. And my own bias towards this topic is that strong organizations never really stop planning. Quite honestly, there is constant movement within the market. There is always change within populations, and the ability to continuously evolve to address those needs is what supports and sustains organizations going forward. To have simply stopped the strategic thinking around what the organization is doing, where it's going, and what needs to happen in order to continuously address the needs of the population, is in my view a tough one, and probably not a decision that I would ever make. I think the reality is, I can hearken back to my youth, and with the parenting that I had. My father was a high school football coach, and you always plan for the game, and you work the plan. So the reality is, the best of strategic plans are never set in concrete. There's always some degree of flexibility. Certainly a pandemic causes there to be a need for significant flexibility, but that doesn't mean that we put the plan aside. We put the plan into context relative to what we're dealing with, but we still have to address the needs of patients who have orthopedic concerns, or have cardiac concerns, or have neurological concerns, because, here's the reality. COVID-19 didn't stop heart attacks. It didn't stop strokes. It didn't stop slips and falls that require a hip replacement or a fracture repair. It didn't stop, everything. We still had to deal with those things. Now, the challenge is that there's probably a lot of patients across the country who may have experienced symptoms that didn't pursue care as quickly as they perhaps should have, because there was a question of, is the hospital still providing those services? Is it safe to go there? If I go there, will I get the virus, etc.? And I think there were individuals who sadly passed on because they didn't seek care as quickly as they should have, or they didn't seek care at all because they felt that it might be unsafe to do so. That's obviously part of the reason why continuous communication with your patient population and the population that you manage, that we're here, we're taking care of patients, we're still managing everything that we do while we're also managing this pandemic. And it's not COVID-19, maybe it's going to be some other issue or concern, just like you said. We don't know that, but we can't keep moving forward. And I think the reality is, healthcare is, and the healthcare services industry is one that has been built off of discovery, advancement, evolution, and continued deepening of our understanding of the overall human condition. That's a critical piece of what we do on an ongoing basis. And as a consequence of that, what we have to continuously do as an organization is to evolve our plan, evolve our thinking, and evolve our leadership to ensure that we have the right physicians engaged, that we have, and they're integrated with us in terms of what we're trying to achieve, that we're taking the physician perspective into account in terms of how we organize our efforts to manage populations, that we're continuously cultivating relationships within the market with the patient population directly, with primary care physicians and other care providers across the region. Obviously one of the biggest areas where we've drawn a lot of patients from over the course of this past year has been in collaboration with skilled nursing facilities.
Mm-hmm.
Certainly that has been an area of significant engagement and concern given the pandemic. Those congregate housing type situations where you don't necessarily have ventilation structures that are negative pressure and the virus can jump from room to room in a hurry, obviously highlighted a need for significant partnership, et cetera. And then finally, I don't think we can ever stop thinking about how we differentiate what we do from the next guy. And in thinking about how we engage and integrate our provider teams, how we organize ourselves to do the things that we need to do in service to our populations, the relationships that we have and that we need to have, and the differentiation potential, that's what gives us the ability to bring value to the market. So, if you ever stop really thinking about those 5 concepts, I think you're missing the boat as a leader and as an organization, regardless of whether there is or isn't a pandemic. The topics that we apply to that series of 5 concepts obviously can change. And certainly over this past year, there's been a lot of thinking around how do we respond to this pandemic? But we also need to think about all of the other services that we provide on an ongoing basis because our patients continue to have needs.
Yeah, it's like when a pandemic came on, if you watch the news, it's like we forgot that people got sick from other things.
Right.
And cancer didn't go away, like you said, and things like that. Using your analogy of a game plan for a football game, for example, football teams come out with a game plan and then they make adjustments. That's why there's so much difference between the first half and the second half, because both teams have made adjustments based on what they've seen and witnessed and what they think will work in the next go round, anticipating that the other side's making adjustments as well. So, as long as we're in this space, I won't trivialize it. I don't want anybody out there to think that we think this is a game. I'm just using that as an analogy. But let's say we're in this space. We're in this space. There's an expectation and there's an obligation on us to be responsive and make these adjustments. Restore confidence in people so they know if they come into the environment, it's safe, things like that. I think strategic planning is a game plan, and you can make constant adjustments to it, but you're not throwing it out the window. You have the same goal. Your goal is to, provide the highest quality care. Let's say your goal is to triple aim. Your highest quality care, greatest patient satisfaction, and lowest cost per capita. That goal doesn't change. How you do it does. So right. I think the need for a game plan or strategic plan helps you stay on that focus. Now, besides COVID, we have an industry that's really burdened by one of the highest, I think the highest CEO rate of all industries, healthcare. And how do you stay focused on a plan when your leadership changes every few years? What's been your experience in that? Consider either before, during, or after the pandemic, but you still have leadership change, and we're going to have leadership change in the future. I anticipate there's probably going to be more leadership change after the pandemic. We can breathe a little bit of a sigh of relief that we're maybe getting on the other side of it. How do you stay focused on strategic goals?
So for me, again, my commitment to healthcare services and, to the organization that I'm leading in particular is that we need to do our level best to serve the needs of the population that we're privileged to serve. And that's through creating access, through providing the right mix of services to know who we are and who we're not in terms of the services that we can and that we perhaps should not provide, and do it in a way that is service focused and has a level of orientation towards consumer satisfaction. Because if we do the A plus B plus C correctly, we're going to generate a reasonable financial return that allows us to continue to invest in the services that we're providing. I think strategically, understanding the market, understanding the population that you serve, understanding what inherently is likely to emerge from that population based upon specific disease categories and age banding is a critical piece. And knowing who you're working with, and specifically who you're working for in terms of patients, always creates the ability to keep moving forward. And at the end of the day, I think there's a reality to the fact that that leaders come and go, but the patients still remain. And regardless of who sits in the CEO chair, the patients are still going to require care, and they are going to expect excellence, and they're going to need the support of the provider team. I was asked back when my son was about 5 years old, we were putting together some Legos, Dad, what do you do? And I tried to explain that to a 5-year-old, and it's a little bit difficult to explain strategic leadership and all of the things that we do as leaders. But I broke it down for him and said, what Dad does is he makes people better. And he asked me, so you're a doctor? And I said, no, I'm not a doctor, but I help the doctors, I help the nurses, and I help the other clinical providers have the tools that they need and the elevated ability to serve patients so that those patients get better. And by helping our physicians, our nurses, and our other clinical team members do what they do best, we ultimately all make people better. And it's this very simple way to think about things, but at the end of it, regardless of turnover, there's always the need and the basis within healthcare that we're here to serve patients, and we're here to serve our population. Mm-hmm. And that servant leadership mentality, I think, is so vitally important. And if we embrace that, quite frankly, and if we build a culture within the organization that ensures that everyone from the top down and the bottom up understands that they play a critical role in making people better, the leadership, quite honestly, doesn't matter quite as much. Who sits in the chair is less important than the theory behind where we're trying to go. Yeah. And the inherent goals and mission and vision of the organization. And I think if we continuously keep our eye on that, Bob, the whole proposition becomes, number one, more deeply fulfilling for those who are a part of it, but more importantly, more enriching for the patients who are experiencing it. Because at the end of the day, none of us really know at what point we're going to need a specific level of care. Access to primary care is something that we should all have, and certainly we should all do the types of things that are within our control from a prevention and wellness perspective. But significant diseases like a cancer diagnosis or having a heart attack or a stroke, those are things that are unpredictable. We don't say, or we don't get to choose when or if those things happen. We pray that they don't, but if they do and they occur, we need to know that there is a team that is committed, focused, and dedicated to making sure that we're going to get the best possible care. Yeah. And I think that starts from culture.
I would agree. I hear a couple of things. I think, I would always told myself is we're either here to serve the patients or serve those that serve the patients. And there's really no other job in a hospital, or any healthcare organization. Either serving that or making somebody's life that is serving them, better, or more productive. The other thing is healthcare systems are like corporations. Corporations are designed to outlive any individuals. The corporation continues. And without making this business-like, but I look at a strategic plan as belonging to the organization. And I typically work with hospitals that have boards. So to me, it starts at the board level. The board owns it. No matter, CEOs will come and go, things like that. Board members shift in and out over time, but there's still a mass that stays with it, and you stay moving in the same direction. That's why I believe governance is critical in an organization that's trying to achieve specific goals, that they need to take an ownership of it, because I said people come and go, and sometimes the CEO leaves by their choice or CEO leaves by the board's choice. But that doesn't change anything. The board already has agreed upon a plan, and that plan is solid, and it's been questioned, scrutinized, and everything else, and they want to move forward. Then they need to find the right person that's going to be helping them achieve that. And if they don't have it, then they need to get that person out and get somebody in that does it. But that strategic plan should survive any one individual in an organization. So it doesn't matter whose name is on the task, because that name can be changed. The fact that the task has been identified, has been resourced, and has to be done to achieve a certain outcome. So I'll emphasize, if I can, the need for governance and buy-in. And that to me is part of the culture equation as well. Because a lot of times the board doesn't know its role, and the organization doesn't know the board's role, and there's some confusion who owns the plan versus who's executing it, who manages the organization. I think all those things are critical to the successful deployment of a strategic plan. If those things aren't addressed up front and made very clear, you're going to have problems executing on that. So I'll just emphasize that again, the goals of the organization are made there. No one person is more important than those goals. And that person can be anybody. It can even be a physician. I hate to say it, but in the scheme of things, in the long-term picture of the organization, that needs to be the driving force, which is why I asked the question, what happens when CEOs leave and things like that? The answer should be really nothing to that plan. It might affect the execution, but it's not really changing it materially, as long as the board owns it.
Let me ask you a question.
Yeah.
I think you hit on something really important there, and I would agree with you. I think the concept of strategic continuation is absolutely spot on. My own bias is that it's important for all organizations, but perhaps even more critically important with smaller and more rural institutions. And I know you and I have both been in those types of organizations. You much more than I have. But having been involved in a smaller organization here where I'm at presently, I can tell you that for an organization of this size that serves a population that doesn't necessarily have the mobility and the ability to move as what exists in an urban environment, having that type of strategic plan, having that type of focused leadership, but also having a board that really understands and is the dynamics of healthcare delivery and is comprised of a balanced mix of individuals who bring business intelligence, clinical intelligence, as well as collective emotional intelligence, to me, is what enables that strategic plan to continue to move forward. But I'm curious about your perspective on rural versus urban.
Well, it's interesting because in a perfect world, it'd be great to have that blend of those perspectives on your board, but a lot of times they're publicly elected and you don't know what you're gonna get in the board. They're all usually there for the right reasons and positive intentions, but the knowledge base may not exist, which is why it's incumbent on the CEO to help educate the board. Bring in the resources that they need to be educated, attend conferences like this one, and keep constantly learning. Just because people aren't on a board doesn't mean they can't attend board meetings and provide perspectives. So I think the board needs to be constantly learning if they don't have that perspective. And even if they had a perspective like a physician's, they may not know the specifics of the situation you're dealing with in your organization, your culture, and everything else too. So I think, again, the more information, the better. The rural, I typically see in rural areas less of a health system presence. Doesn't mean it doesn't exist, but I've seen primarily special districts and other types of arrangements where the boards are really representative of the community versus health systems I see more in urban areas, but not exclusively, where I think there's a different perspective in terms of governance. Who's driving the initiatives, who owns the initiatives, and how they're executed. Are they a top-down or bottoms-up type of perspective? I think in rural, you have the opportunity for more of a local perspective because that's your world right then and there. If you're a special district, you have an elected board. They shop and bank and everything else with everybody else in that community, as opposed to a health system with the management executives and leadership in another state. I'm not saying one's better than the other yet. You just asked me what the difference was. I think it depends on what the goals for the organization are. And as you say, they're usually around serving the patient, and you can do it from both ways. And I'm not saying one's better than another, but I think in a local rural community, you're going to have a local perspective a little bit more than you would not in an urban area.
And I think the other piece that builds off of that discussion when you talk about leadership, somebody coming in a transitional role, when you have one of those types of turnover situations, bringing in somebody from the outside versus inside, what do you think there?
Yeah, well, I'm a little biased because I'm typically the outside person they bring in, but I think that as an outsider, you have the ability to see things a little bit more objectively. You're not part of the past history. Assuming you can get an accurate picture of the history, you can make decisions that are really, I think, based on the information you have available, the right ones without bias, because you're not part of the historical, past that's played out to get the hospital to where it is right now. So, that was a question I was wondering about for you as well. The fact of, what should an organization do when the leader leaves? And I talk about this a lot, particularly with boards. They feel like the world's been knocked on its side. The CEO was either there for a really long time and well-liked and decided to retire, or the leader was there for a very short time and not well-liked. You have the full gamut. I think regardless of those, I've come into situations where there's been a CEO that's been there for 15, 20 years and left. And the same as I came as somebody that had been there for a year and left. And both of those, I think, are appropriate to bring in an outside person because it lets you reset the stage, looking at the strategy, always do a warm handoff to whoever the permanent leader is. Whereas if you bring an existing resource in that, a lot of times they're diluted in their roles. They have conflicting priorities because just of the way that their organization's structured. They don't get the opportunity to say, hey, time out for a minute, let's reset this stage and take a good look at it. As an outside perspective can do that, whereas an inside perspective feels like they don't always have the ability, they can't afford that luxury of resetting.
Yeah, I think that's actually a good perspective, Bob. One of the things that I would add to that is that, by an organization bringing in somebody from a transitional perspective, it allows the organization to take a look at things through an external lens. Again, you and I both have experience with many organizations and have, years of experience and, have learned to some degree through hard knocks what does and doesn't work. And obviously, I think the perspective allows us to see things perhaps a little bit more quickly and do some level setting. Even if an organization has a very strong candidate internally, the ability for somebody to come in and do a rebalancing so that if that individual who is internal ultimately becomes the permanent leader, they're taking things on with a fresh board and the ability to start anew, as opposed to trying to immediately step in and fill shoes that may not have fit, that may not have been the right shoes, or may not have been the best approach. And as a consequence, it's always important. I think for anyone coming into a leadership role, it's important to have kind of that clean slate. Even if you're coming into a situation that's going to be a full-on turnaround, clean slate leadership gives the opportunity to really set things in motion from the standpoint of building a culture, creating buy-in, and ultimately advancing as a collective team, rather than there being a perception that there's any part of legacy. Because I think, again, even in organizations where you've got somebody who has been a well-liked, highly focused and successful leader, somebody who immediately steps into that is going to be expected to be that person, mm-hmm. or be, in that vein. And, that's not necessarily fair to the individual coming into the role. Now, that said, high-performing organizations expect to continue to be high-performing organizations, as they should be. So, whether it is an immediate or a transitional placement, you need somebody that can, very rapidly come in, assimilate into the environment, become a functional part of the team, really embrace the team for who they are, but also look at things from the perspective of where are their opportunities, what are we not seeing, what are we not turning over from that proverbial rock standpoint. And it's one of the things that, that I certainly have valued in being able to undertake the role that I'm in now, and I've also valued in others that have come in as transitional leaders to organizations where I've been, is that you get a fresh perspective, and basically everybody gets an opportunity to have that fresh start, and that's a critical piece in terms of being able to move forward with any type of a plan. Right,
and in interim or transitional leaders' job, really there's one focus, and that is to make the new permanent CEO successful. So you need to set the stage for that person to be successful. That means dealing with the things that you don't want a new person to have to deal with. And if you're dealing with an internal person versus an outside person in that role, sometimes the internal person just doesn't have the ability to leverage that enough because how they've been seen in that organization. Whereas an outside person does have the ability to show some things through an external lens. We have about a minute or so left, and I don't want to ask you a world hunger type of question, but I wanted to ask you if you could say this as concisely as possible in a couple words. It's two-sided. What can boards do to keep their CEOs longer, and what can CEOs do to stay longer in their roles? If there's any advice you would have for people. So don't go through this high turnover.
So I think there's a couple of things very briefly. First and foremost, I think, fit is everything. And for me, it's understanding the organization that you're joining and understanding the board that you're working with. The board is an organism just like the hospital is an organism. And there are viewpoints, strategic inputs, and relationship opportunities that need to be cultivated there. I think each board member brings a unique perspective. So a leader coming in has to understand, engage, and focus on and find those relationship points that are going to be important to those individuals, but then also understand on a collective level, what are the strategic areas of importance to that group. At the same time, that leader has to be able to engage in, permeate throughout, and ultimately infiltrate every aspect of the organization itself. So really, the dynamic leader needs to be a person who can work up and down the organization, that can engage with the board, that can engage with the staff at every possible level, and cultivate relationships. One of the things that has been most impressive to me across the years that I've been in healthcare, and I've worked with some incredibly dynamic leaders, some of whom I still consider my greatest mentors. But probably my greatest mentor is an individual who is still a CEO of a major health system in the Northeast. And this individual not only knew every person in the organization, but could sit down at a lunch table with any single person, have a conversation, and was genuinely interested in every single thing they had to say, and was very open, honest, and transparent about where the organization was going and where every single person played a critical part to the success of the enterprise. And the ability to engage people at that very basic human level is what engages people and ultimately makes those individuals who are team members not just want to be on the team, but to be a really significant contributing member of the team and to continue want to advance within the organization. That is also what the board wants to see from a leader, because if we've got people engaged at that very significant level, if everybody's pulling the oars at the same depth, at the same pace, and with the same stroke, that ship's ultimately going to move a lot further, a lot faster. It's going to retain employees. It's going to elevate their performance. It's going to produce better results, which leads to greater satisfaction and ongoing relationships throughout the community. And that's the type of relationship success that then the board, if it's cultivating, supporting, and engaging with the CEO in that way, is going to find that they can keep that individual longer. And it also creates a level of organizational performance that the entirety of the team, board down, lowest level employee up, can be extremely proud to be a part of.
Yeah, I look at the CEO position as kind of that pivot point in an hourglass. It's not really a pivot point, but the narrow point in the board's on one side and the organization's on the other, and they have to constantly be addressing both sides, the needs of both sides. But to me, it's a more fundamental answer than that. It's more of a if you get joy in your work and you're engaged, you're going to stay, and people are going to be satisfied with your work. And if you're not getting joy out of your work, people are going to pick up on that. We certainly see it when there's a disengaged person. We could probably walk down the hallway and tell who's engaged and who's not. Well, why would that be any different for a CEO? It really wouldn't. And to be getting joy in your work, it means you're clear on your expectations and you know what's expected of you by your organization, including everybody that reports through you and the board. And to get to that clarity in your expectations, to me, it goes back again to the game plan. If everybody knows what their role is in the game, you're gonna be able to execute. And if you're gonna execute, you're gonna make progress. You make progress, you're gonna get joy. If you're constantly stumbling and not making progress, you're probably not gonna get joy. So, and joy doesn't always have to come from success. Sometimes, as long as it doesn't have really an adverse impact, you can learn as much, if not more, from a failure. But as long as you're meeting the expectations of the organization and your board, that failure can be a learning tool to build upon. So it also shows transparency, humility, the things that go to the human condition, as you talked about before, that I think, again, all go into one big bundle that create an outcome what I call joy. So I don't mean to oversimplify it, and I apologize that I have to cut us off here. But I've really enjoyed having this conversation with you, and I'm glad the people that could join us today. I hope you got something out of this, and if you have any further questions, you can reach out to Kyle or me through the forum here, the symposium. You can go to our booth in the exhibit hall and reach out to us as well. So thank you again, Kyle, for your time. Appreciate your work, taking time from it to meet with us today.
No, absolutely. And I'll close with this. I'm reminded of the words of Margaret Mead, who made the statement that never doubt that a small group of dedicated and focused people can change the world. Indeed, it is the only thing that ever has. And getting joy, gaining joy is one thing, but I also think it's important for that work to matter. And I do believe that what we do in healthcare matters, and it makes a real difference in the lives of the people that we are privileged to serve, and never doubt that it is truly our privilege to serve them. So
Absolutely.
Thanks for inviting me. I really enjoyed the conversation, and certainly feel free to reach out.
Yeah. Thank you very much. You have a good day.